former speaker has made my job very easy. He's already voted in my favor. I think single use is better. I'll just reinforce that message so we are both saying the same thing. So I do agree that I think you don't probably need it for every case, but I'll show you why I think the future will be in part with disposable cystoscope. These are my relevant conflict for this talk. What are the limitations of reusable scope? The cost is higher, it's easier to damage, cross-infection, sterilization, and efficiency of operating room. And we all know with increasing things like Tula and Botox, there is a high risk of damage to these scopes, which is not always captured. So our procedures are becoming more and more complex and complicated. So, So what are you looking for? You're looking for improved patient safety, decreasing cross-infection, reducing the time taken, because time is also in some ways money, reducing the overall cost, procedural outcomes, of course, user satisfaction, and the environmental impact. And these are all aspects which I think in part or wholly single-use cystoscopes now are delivering in a better way. So the history of disposables, we know that we are using all of this. Why? Because that was the right thing to do. And I think this is how the single-use cystoscope will be going. We looked at a micro cost analysis. This is in 2019, pre-pandemic, using reusable cystoscope in endoscopy suite versus disposable cystoscope in outpatient clinic with the Isurus stent removal cystoscope, which had just come in. And we did a full micro costing analysis and looked at the cost savings and direct and indirect patient benefits. And these were the results. For the reusable scope, the cost per procedure was higher, but especially when you include some of the complicated cases with delays, etc., the cost was much more higher, and it was significant in both occasions. And bearing in mind, now the cost of reusable, single-use cystoscope is even lower. It's less than half of this. So naturally, it is much, much more cheaper than what it was in 2019. Now, I won't go through this. This is a very detailed slide. I just wanted to show you that we have looked at every single step in this micro cost analysis. And we have looked at every single aspect, including monitor, price of processing, everything that was included, and that's how we came to the cost calculation. So what was the other benefits? So cost is one element, right? What were the other benefits? It significantly reduced the stent dwell time, significantly reduced the procedural time. The staff needed was also reduced, and it reduced the overall number and waiting period for the cancer rates of patients waiting for diagnostic or follow-up cystoscopy. So you're not just helping your patients, you're also helping patients with cancer rates who need to have cystoscopy. Now, what about the workflow efficiency? Because there are different aspects to processing, right? So with this, in this paper, they looked at the workflow efficiency for pre and post procedure, and it showed benefits in terms of the labor time, in terms of repairs and service contracts, and patient waiting time and turnaround time and staff time. So overall, at all aspects of this cycle, there was time saving. And thank you for pointing out this paper, which actually does show that disposable scopes seem to be better. And I won't go into the details because it's already been mentioned, but how is it better? 5 aspects were looked at: mineral resource depletion, climate change, ecotoxicity, acidification, and eutrophication. And in all of these aspects, so disposable scopes, much favorable in terms of climate change, much favorable in terms of mineral resource depletion, much favorable in terms of ecogenicity, ecotoxicity, and acidification, and the eutrophication. Basically, it is environmentally more friendly. That's the bottom line. And disinfection processing was found to have significantly larger footprint than single-use scopes. What about our own? We did a cost analysis as well, looking at environmental footprint of both of them, using original data and then a systematic review from 5 studies, including our own study, and looking at total carbon emissions. And my friend is right. It is about how it is calculated. So with reusable scopes, the calculation was almost 2.4 to 4 kilograms of carbon dioxide per case. For single use, it was much less in all cases. So although there might be variation, but single use seems to be winning the carbon footprint battle. And the result, of course, did vary based on how you calculate it. So looking at the other trend, environmental trend was much better with single use. And again, this has been pointed out in a number of reviews and original article papers. What about newer type of designs? We haven't even talked about this. Are there newer scopes with suction, perhaps which can deliver something extra? So what about adding that extra dimension in terms of user friendliness? What about surgeon controlled aspiration and suction? Can it actually help? So I've used this with an integrated suction button where the fluid management system allows you to operate with suction. Is it a game changer for future? Because this, I think, unless you use it, it seems to be a game changer. Maybe not in every case, but in a lot of cases. I'll just show you a video of a particular case. This is a patient. You can see it's you can see how the system works on the other side with just with a finger control button. And you can see there's a lot of dust and debris, which is not uncommon in some of these patients. And you can just suck the dust and debris with this. The fluid comes in, you can suck a bit more. So it's much easier to wash the bladder out, which is what you have to otherwise do with syringe, or you have to lower the bag or change the bag. This is just so much more intuitive because you can put, similar to flexible electroscope, but it is now in flexible cystoscope. And you can see the amount of fluid we were able to collect, which otherwise would have taken a lot longer to wash out. So we are talking about an environmental footprint, which is probably better with this, cost, which is probably better with this, and also the newer technological aspects like suction, which allows you to do a better job in some patients. Now, this is a patient, the next video, with a reconstructed bladder with mitrophen off and bladder stones. I wish I had the stone with the suction scope. I didn't have it for the time. I'm trying to do manual syringing, breaking the stone, lasering, manual syringing. It was very, very difficult. And if I had one of the suction buttons, my life would have been so much easier because the laser would have just stayed there. I'd have just done periodic aspiration to clear the view. And I think this is the beauty of having the newer advancements such as suction, because that really allows you to do these difficult cases with a lot more ease. So although I'm not saying it is needed for every case, but there's certainly a large proportion of cases where the single-use suction scope is more cost-effective, is probably more environmental friendly, and much more useful in complex cases. So what are these complex cases? Maybe cases like this I've just shown with bladder stones, maybe bladder tumor because you have got a bit of necrotic fluff or debris that settles down, you can just wash it off. Maybe patient with stones, and in a lot of other patients where there is chronic retention and bit of turbid urine that you want to clear, like the one I've shown you previously. So, and maybe local treatment of other bladder pathologies, because nowadays, like Botox and so on, sometimes there's a bit of ooze. If you have suction and washout, you can just wash it out at the same time. So I do think that disposable scopes are the way forward. Thank you.
Thank you very much.